Our last speaker is going to be Jesse McLaren. Jesse McLaren is an emergency physician and a member of the Decent Work and Health Network. Take it away, Jesse.
The Decent Work and Health Network is a group of health providers across Ontario advocating for healthy labor policy based on medical evidence. And through this lens, I want to look at three themes with a focus on Ontario. First, why is there a health crisis? Secondly, who is most affected? And thirdly, what we can do. And I'll be echoing a lot of the themes that all the panelists have identified. So first, why is there a health crisis? The most obvious reason is biological, that there's a new coronavirus to which humans have no pre-existing immunity. It's easily transmissible, including during the incubation period, and there's no vaccine. It can produce COVID pneumonia, which has an average mortality rate of 1%, but which is much higher in elderly patients and those with chronic health conditions. And there's no antiviral medicine that's currently available. So all of this poses a challenge from a biomedical point of view and can account for the rise of the pandemic, illustrated by the number 1. But the impact that COVID has on society depends on social and economic conditions. Whether the pandemic overwhelms hospital capacity, depicted by number 2, obviously depends on the hospital capacity before the pandemic, which, as Fez explained, has been undermined for decades. Poverty and precarious work increases the rate of chronic health conditions that can worsen COVID, which can contribute to a higher peak, like in number 3. And precarious work contributes to people going to work without protective equipment, rather than have access to paid sick days and PPE, like number 4. The social and economic conditions that affect pandemics also reflect political priorities. And the year 2019 showed this connection. In January, Bill 47 took effect, freezing the minimum wage, revoking paid sick days, and bringing back useless doctor's notes. And in December, the first case of COVID was identified, a disease that thrives on low-wage, precarious work. Now, obviously, nobody could have predicted COVID-19. And without Ford's policies, the pandemic would still be a challenge for all the biomedical reasons and all the other social and economic conditions. I didn't just start with that government. But I think it's clear that this legislation makes the pandemic worse and was brought in against the warnings of health providers and the decent work movement. This graphic was actually produced more than a year before COVID emerged, without any idea of the coming pandemic, but with full knowledge of the health consequences of precarious work. The Decent Work and Health Network warned against the health consequences of this bill, writing, quote, "Holding down wages does not reduce costs to our health system, it adds to them. Similarly, revoking paid personal emergency leave does not immunize employees or their families against unexpected illness. On the contrary, it reduces access to preventive health care, increases the likelihood of contagion at work, and prevents workers from quickly recovering and returning to work. We can either pay for paid sick days, or we can pay for it with sick workers, sick coworkers, sick clients, and more overcrowded hospitals." So when the government brought in Bill 47, they did so with full knowledge. The labor critic warned that the government wants you to work sick and wants you to struggle with two or three precarious jobs, which is exactly the conditions in long-term care. The Fight for Teen and Fairness campaign warned that to cut wages, to cut sick days, and to make it easier to fire workers who already are in precarious situations is cruel and callous in the extreme. But the labor minister responded by saying people are free to choose their work arrangements, and the health minister said that she supported all of the provisions of the bill. So the second theme is who is most affected. Now, the phrase goes, we're all in this together, that COVID doesn't discriminate, but no disease affects everyone equally, even in the most narrow biological sense. And from the start of the pandemic, we've known that anyone can be infected with and can transmit the novel coronavirus, which is why universal precautions are so important. But that 10% of cases are in health workers, so we need protection for all health workers. And then the mortality rate rises with age and with chronic health conditions. We especially need to protect vulnerable patients. And sadly, we've seen this play out in Canada, where COVID has been diagnosed in people of all ages, where 10% are healthcare workers, and half of deaths have happened in long-term care. But the unequal distribution of these is not just a biological phenomenon. And COVID deaths in the elderly are not just a natural consequence of aging. Social and economic conditions determine the rate of chronic health problems that increase COVID mortality. The funding and operation of long-term care determines crowding conditions in which it can spread, and Zaid has explained the impact of cuts and privatization. And low-wage precarious jobs influences whether healthcare workers go to work sick, whether they have access to PPE, and whether or not they themselves get infected. And as Iman discussed, around the world, hospital workers are both being denied PPE and at the same time targeted for speaking out about the lack of protection. And as Simran explained, these conditions are not equally distributed, but women and racialized communities are concentrated in jobs that are both at the front line and precarious. And I don't think it's a coincidence that the first healthcare workers in Toronto to die of SARS and the first to die of COVID were all workers in precarious jobs, disproportionately women of color. This brings us to the third theme of what we can do. Now, the Ontario government's graphic here has repeated the same public health messages to wash your hands, cough into your sleeve, keep surfaces clean, and stay home when you're sick. And of course, all of this is important in the abstract. But simply calling for this without addressing the working and living conditions is totally inadequate to help the most vulnerable patients and the vulnerable frontline health workers. So long-term care patients are already at home, but without safe facilities and healthy workers, they can get infected. Cleaners are already working to keep surfaces clean, but without PPE, their lives are in danger. Care workers are already washing their hands, but as Autumn explained, they're denied PPE and facing cuts to hours. As Amrita explained, nurses who run paid sick days have to either go to work sick or suffer financially or potentially even lose their job. Now, the Ford government has promised to use every tool in their toolkit because lives depend on it. So they extended personal emergency leave days and eliminated doctor's notes, partially reversing their previous policies, which the health minister had fully supported. But first of all, you'll notice that it's only related to COVID-19. So if you get the flu or gastroenteritis, you're out of luck. Secondly, none of these days are paid. And third, instead of empowering workers to stay home and sick, the legislation empowers employers to police their workplaces and send sick workers home without pay. Now, how employers are supposed to decide who's at risk is not addressed, but it's no surprise how this will play out in practice. We've already seen that Chinese Canadian workers have been sent home without pay for coughing while their co-workers have not. So in response to the worst respiratory pandemic in a century, the Ford government refuses to provide a single paid sick day. This will disproportionately hit low-wage workers who are most in need of paid sick leave, who are at the front lines, and it will especially affect women and racialized workers, with a special targeting of the Chinese community. So it's for all these reasons and others that the Decent Work and Health Network is calling for 7 paid sick days plus 14 additional paid days during the pandemic, increased access to EI and an emergency fund, and no tolerance for racism and xenophobia. When it comes to a health crisis, we need to follow the priorities of all frontline workers. And I'll end with a quote from Carolina Jimenez, the coordinator of the Decent Work and Health Network. She said, "Clearly, precarious employment anywhere is a public health hazard everywhere. Whether we are health workers, food workers, cleaners, security guards, or delivery workers, we need to ensure that everyone has decent work, basic health and safety protections, and crucially, paid emergency leave. Every single worker needs a minimum of 7 paid days off as a permanent measure. And during an outbreak, all workers, whether they are unionized or not, should be legally entitled to an additional 14 paid days." Thanks.
Thanks so much. So I'm just going to pass it over to Jesse for your concluding remarks.
Yeah, thanks for all the panelists and all the participants. I found it really helpful to share experiences. Maybe we'll just start with the helpful comment about ER overcrowding, because that's kind of where I work. And so, as everyone knows, these were overcrowded before the pandemic. There's been decades of cuts to hospital capacity. Premier Ford was elected actually on a promise of ending hallway medicine. And we all know how that turns out after he cut public health, cut paid sick days. And it's actually COVID's having a differential impact within the emerge. So on the one hand, there's obviously people with COVID or those concerned about COVID who are coming to the emergency department. On the other hand, a lot of people with real medical emergencies are not coming to the emergency department. So, and this has been seen globally. A lot of the countries that have been hardest hit have had a paradoxical drop in the number of people with heart attacks, and that's not normal. So one of the concerns is that these blanket commands, stay home, and these commands are backed up by threats of fines, and police force are actually keeping people with real emergencies from coming to the hospital. And plus just fear. I've seen patients who have left the hospital against medical advice because they're so terrified of COVID. When what brought them to the hospital, I have more concerns about that than them getting COVID. Plus there's all the clinics and services which have been disrupted, plus there's the mental health consequences of the pandemic that a number of the panelists talked about, all of which will have a differential impact, especially on workers in precarious jobs and on women and racialized and disabled people. So this brings up the fact that the COVID curve eventually will come down, but this actually could be followed by other curves. There'd be curves of people who haven't had access to their medication, haven't had access to their clinic, haven't had access to mental health supports, haven't been going to the hospital for their emergencies, and having heart attacks at home. And then this just emphasizes the importance that we can't deal with this as a simple temporary crisis with emergency measures that are instantly lifted, taking away the leave days, taking away the minimum wage hikes, taking away any kind of gains which have been won in order to return to so-called normal, because normal is actually what got us in the situation in the first place. And we actually need a new normal based on large permanent measures. I think if anything, that the scale and the disproportionate impact of the crisis has highlighted pre-existing social and economic inequalities, and we have to address all of these, both to get out of the pandemic and to improve health in general. And secondly, just from this panel, I think I've learned a lot of that frontline workers know best, and precarious workers, of which I am not one. So I just want to come out and say that I'm not a precarious worker, and that's why actually I'm part of the Decent Working Health Network, because it is not just a bunch of physicians making policies, but is following the leadership of the 15 Fairness movement, which is led by workers and frontline workers in both in health and other aspects of health. And clearly frontline workers, whether it's cashiers, grocers, nurses, PSWs, they know their living conditions, they know the conditions that put themselves at risk, and they know the conditions that will help both them and their patients and their clients and the public. And so, by building movements like the 15 Fairness movement, like the Decent Working Health Network, I think we can not only get out of COVID, but also win a better world.
Amazing. Well, let's have some air claps for all our incredible speakers.